Hello, Assalamu alaikum. My name is Dr. Faisal Anwar. Today we will discuss a case of phacoemulsification. This case of phacoemulsification is performed in a case with floppy iris. So let's start. First of all, we will make a phaco port that is 2.8 millimeters with the keratome. After taking entry into the anterior chamber, we will inject trypan blue to stain the anterior capsule. You can see the anterior capsule is fully stained now. Now we will wash the trypan blue dye to clean the AC completely. Now we will inject viscoelastic into the anterior chamber. After injecting the viscoelastic into the anterior chamber, we will perform capsulorhexis by lifting the flap in anti-clockwise manner. You can see here first of all we will lift the flap. Now we will rotate it. And we will complete the rhexis. The size of the rhexis is 4 to 5 millimeters in size. That is adequate for performing phacoemulsification surgery. Now we will make another entry port with 15-degree knife. Here we are performing 3 port surgeries. So we will form 2 ports with a 15-degree knife. Now we will remove little bit gel and perform hydrodissection, which will be gentle. You can see the iris prolapsed to the side wound. Now again we will perform gentle hydrodissection to separate the capsule from the cataract lens. Now we will inject again viscoelastic and dial the nucleus. You can see the nucleus is easily mobile in a clockwise direction. Now we will take phacoemulsification in the anterior chamber. Now we will perform phaco chof by burying the tip of the phaco into the nucleus, and you can see this is the first chop that is performed. Now we will dial the nucleus and again perform the second chop. The trick in a floppy iris case is to make all the pieces in a single go. If you will come out, the iris will prolapse. So first of all, make all the pieces. Make the nucleus or a cataract lens into small pieces by making multiple chops. Now when the nucleus is fully chopped, we can remove these pieces very easily. This can stop the iris from prolapsing from the multiple ports. You can see we are lifting the hard nucleus and emulsifying it. Now again we are lifting the other pieces one by one, so we can emulsify them as well. Once you have lifted or emulsified 1 to 2 pieces, remove the dialer. It will deepen the AC and make easy for you to remove the rest of the pieces. Now you can see again we are repositioning the iris and going into the anterior chamber and removing the rest of the nuclear fragments. This is now the last pieces of the cataract lens are now being removed. So this is the last emulsification of the part of the nuclear fragment that is performed. You can see we are almost finished. Now we are gently removing the cortical matter with the phaco. As the nucleus was hard, so it came out with the nuclear fragments. So this is the last piece that is guided to the tip and removed. Now we will perform the irrigation aspiration. To check if the any of the cortical matter is left or completely removed. Next step is to again put in the viscoelastic into the anterior chamber to implant intraocular lens. Just again checking if any of the cortical matter is left, so it is completely removed. So now we are injecting the intraocular lens into the eye. You can see the lens going into the capsular bag. With the help of the dialer, we will guide the other instrument, other haptic into the bag. Now the lens is completely into the bag. Now we will gently remove the viscoelastic from the anterior chamber and the capsular bag. Now we will remove the remaining gel from the anterior chamber. Just to keep the cannula inside near the lens, gel will automatically be removed. Don't do aggressive suction to remove the gel. You can see the AC is now completely washed. And the case is completed. Now we will perform the hydro sealing of the ports. The trick in this surgery in this case is of a floppy iris is to perform the phaco chop in a single go into multiple pieces, 6 to 7 pieces, and then gently remove the phaco chopped pieces by keeping the phaco tip in the center and removing the dialer from the anterior chamber. Thank you.